Every time I look at my phone, there seems to be a new TRT company that's popping up. Most of the time, these companies don't know what they're talking about. And I'll tell you right now, TRT is not for bodybuilding. And it's certainly not for enhanced performance. TRT is not about aging biohacking. For the right person, TRT can make a real difference to cognitive function, mood, energy, building lean muscle mass, losing fat, and improving bone health. Don't believe everything you hear about testosterone replacement therapy. It won't fix everything. You need to get tested. You need to understand what your body is doing before you apply testosterone replacement therapy. So what's the problem with TRT? It's not just simply taking medication. First of all, you need to optimize your entire body. And what do I mean when I'm talking about optimization? I'm talking about doing comprehensive blood work, looking at your cardiovascular system, looking at your metabolic system, i.e. your insulin resistance, looking at your adrenal function, that is your circadian rhythm, what your cortisol is actually doing. See, the majority of these TRT companies, they're only going to test you for what they need to know to give you a medication. They're not going to test you for what they should be testing for. So they can optimize you first, specifically over a 12-week period before administering a medication like TRT. So why is testosterone important? Well, from the age of 35, men lose total testosterone at about 1% each year. Importantly, they lose 3% of their free testosterone every year after the age of 35. What's the difference between free testosterone and total testosterone? Well, total testosterone is the amount of testosterone that's running through your blood. Free testosterone is the amount of testosterone out of that total that's bioavailable to have an action at the cellular level. And when you go to most doctors, most GPs, they'll only look at your total testosterone. They won't look at your free testosterone and your sex hormone binding globulin. Now, why is that important? Sex hormone binding globulin is an enzyme or a protein that's made within our liver, and it binds to testosterone. And when it binds to testosterone, that bind is unbreakable, and therefore that testosterone cannot impact or have its impact at the cellular level. So if you're getting tests from a doctor that's only looking at total testosterone, they don't know what the hell they're doing. Many men over the age of 40 notice low energy, fatigue, brain fog, poor concentration, inability to build lean muscle, increased body fat. And they all put this down to increased stress, the life of a middle-aged man, and that they should just push through it because they're getting older. That is absolutely wrong. Low testosterone can impact every single cell in your body. We have androgen receptors in our brain, so low testosterone has an impact on cognitive function. We have androgen receptors throughout our cardiovascular system. Testosterone increases red blood cell production, which increases the amount of oxygen that you can carry around your body. Testosterone is important for metabolic function. Why? Because it keeps insulin resistance at bay. Testosterone is also important for musculoskeletal health, bone mineral density, and bone strength, improving ligament strength and tendon viability. If you're feeling tired and flat and you're in your 40s, this isn't necessarily normal aging. Low testosterone can impact almost every system within your body. And that's going to impact how you feel day to day. It's going to impact your performance at work, your concentration, your brain fog. It's going to impact your exercise tolerance. It impacts your metabolic function, your ability to be insulin sensitive, therefore lose fat. There are some common myths associated with testosterone replacement therapy. And probably one of the biggest ones is testosterone replacement therapy causes prostate cancer. Testosterone replacement therapy does not cause prostate cancer. There was a large study performed by Bayak et al. That looked at testosterone replacement therapy and the incidences of prostatic disease. It occurred from 2006 to 2020. And what it actually found is that it reduced the risk of developing prostate cancer by 16%. The other myth is that testosterone replacement therapy causes cardiovascular risks. This again is not true. There was a large phase 4 clinical study called the Traverse trial that was performed on 5,500 men, middle-aged men to older men, that were followed for 33 months. And what it found was that TRT did not increase the chances of you having a major adverse cardiovascular event. Testosterone replacement therapy is not a one-size-fits-all. Some men may have low testosterone readings, but their symptoms are not that bad. On the other hand, you may have someone that has a higher testosterone level, but still has these adverse low androgen symptoms. That means that testosterone impacts people in different ways. So you need to find someone that's going to be able to apply the medication in a specific manner to meet your needs. Now, testosterone can be delivered through a number of different means: gels, creams, injections, and troches. All these have a part to play, but they only have a part to play for you and your needs. So, what are the contraindications or things that would stop someone going on TRT? And these are the things that you need to test for. Firstly, cardiovascular risk factors. Them by themselves are not a contraindication. However, if you have metabolic dysfunction, i.e. raised insulin levels, you are becoming insulin resistant, or you have increased inflammation, both these things need to be fixed before you go on testosterone replacement therapy. Why? Is because both increased insulin running through your blood and increased inflammation will suppress testosterone's ability to bind at the cellular level. This means that it can't have the effect that it needs to have. So all you're going to be doing is adding fuel to the fire. I've been on testosterone replacement therapy for 3 years, and it has absolutely changed my life. It's improved my relationship with my kids, and it's improved my relationship with my wife. Not only that, but it's improved my performance at work. I can concentrate better. I've got less brain fog, and I can remember where my car keys are, and I don't have to blame it on my wife all the time. But testosterone replacement therapy isn't for everyone. You need to get thoroughly tested. You need to understand what your body is doing. My most important message for everyone out there is, don't listen to people on the internet who don't know what they're talking about. Because if you're not optimized, testosterone replacement therapy can have disastrous consequences.